So welcome everyone to this episode of MoveMint Medicine. Thank you to those who have joined us so far. Please continue to share the podcast with your family, friends and colleagues, and also comment on the videos, and we'll be happy to respond to any questions that you have. We thank our partners for the podcast. So that's the Fit India Movement, the Back to Fitness Clinic, which is the clinic that Rajat runs, La Ultra The High, which is the race that Rajat puts together, and the Moving Mountains Within Film, which is the film about the 10th edition of La Ultra The High. So I'll hand over to Rajat to introduce our guest today.
Thank you so much, Darren. So we have a special guest today, Dr. Tvisha Parikh, and she's a sports medicine doctor, has been to the race that, which is a partner to this movie, to this whole podcast and the movie that's being done on it. So she knows it inside out, and we'll talk more about it anyways. So welcome, Tvisha, and please just get on with introducing yourself as far as academics and profession goes.
Sure. So I am a sports and exercise medicine physician. So after a medical degree, MBBS degree, I did masters in sports and exercise medicine, and I further did a PhD in sports and exercise medicine. Because sports and exercise medicine is such a budding field, that's how I realized that, a PhD would be good, because the field is so evolving that we need to keep up with the research and everything that's going on. There's something literally evolving as far as treatment of injuries, or something to do with lifestyle medicine, the types of exercises, variations in exercises, the various philosophies which are used for exercise. Everything's just evolving literally every year. What I studied in my master's and what I'm currently practicing today is probably not exactly the same. It's literally like that. So it's a great field to be in. And I think it's very much a requirement of today's sports and exercise medicine because of obviously the inactivity levels in the society. People think that sports medicine is just about athletes, but of course I think all three of us here concur that the bigger challenge that the society is facing today is physical inactivity, and that's where I think all of us as academicians and clinicians have a massive role to play to break this barrier of inactivity, to get people moving, literally just to get people moving. And of course, where we would come in as doctors would be that we would want this movement to be done in a more precise scientific way, and keeping in mind the person's medical background. So if he's got a little osteoarthritis or certain injuries or complaints, that's where as a doctor we would step in compared to somebody who is a fitness trainer, because fitness trainer is more for general population. But as a doctor, okay, if somebody has a medical issue, we still want the person to exercise. There's literally no situation. I think you've had a podcast before wherein you spoke on cancer, exercises for cancer. So we're not, we're here to promote exercise for each and every person, a cancer patient or a neuro patient or whoever. But it's about doing it a little bit more scientifically. That's where I think a lot of expertise of a sports and exercise medicine physician would come in.
Fantastic. So what about your personal sort of fitness journey? Have you always been active from a child until now?
Yeah, so I used to be I used to be a basketball and a hockey player, predominantly a basketball player in school, competed at district kind of levels. But then the way it happens is once we get into medical school in India, and more so in Bombay also, I would say, everything kind of fizzles down. The whole focus first for getting into admissions. And then, so because of all of that, I kind of stopped playing basketball except for a little bit here and there. But I continued my fitness activity. So that's when I think it was the transition age when we were in medical college, when the gym concept really came about, I think, in India especially. We didn't have, gyms were not so popular and big when I was still playing basketball. But I think that transition when I entered medical school is when the gyms came about and the whole fitness movement really began. So it was fine. I entered transition into more of fitness, and I've been lucky that I've been in a family which has always promoted physical activity and sports. Again, sports being more recreational rather than competitive, because again, it's a medical and a doctor family and a science family, so focus tends to be a little bit more academic. But I think I'm lucky that I eventually, once I finished my medical school, I combined the two, and I decided to use my medical knowledge with my interest of fitness, and decided to really kind of looked for this field. I had not heard of sports medicine. I had not really heard of sports medicine. So it was just that there were certain things which were always nagging me as a fitness enthusiast. And as a doctor, a layman would just ask me when they saw me in the gym that, they would ask certain typical questions like, how much water should you drink, and when should you drink water, and how many sets and reps to be performed. And I think that's when really the whole trigger started. I started thinking that, okay, who gives the answers to all of these things? So that's when I decided to look up, and I figured there's actually a field by the name of sports medicine. And so I said, okay, that's perfect, because I had not heard of any doctor. I mean, unfortunately, I had not met Dr. Rajat till then. So, and I had not Googled him either. So I didn't know of many people. Like I said, I'm from a doctor family. So till then I had only met pediatricians, dermatologists, ENT specialists. That's all. That's the only people I had met the 20 years of my life. So I said, that sounds like an interesting field, sports medicine, because everybody is doing it. Everybody is doing physical activity. Everybody has the doubts. When I had the doubt, I asked my father, who's a doctor, who's a pediatric surgeon, that, okay, when should I have the water? How much water should I have? And I figured that although, I mean, of course, I consider him like the God, I mean, I was like, he knows everything. And I figured he probably didn't have the correct answer. So I said, okay, let me go ahead, enter this field and find out the answers myself. So that's how I kind of merged the two. And I've since then I've always been active. I don't have massive sporting achievements that I can boast of, but the only thing I can say is that I'm consistent. I'm consistent, come what may. So I think the only thing I can boast of is literally that whether it was my PhD or the day of my submission or whatever it was my final MBBS exams. I was consistent. If I was in the middle of books and everything, I still had my family who would be like, just go down and take a stroll, just jog a little bit for at least 15 minutes. That's the bare minimum you should just do. So I think that's the only thing I can boast of, is that I've been consistent, and I think that's important.
Of course it is, Trisha. I mean, discipline, right? Discipline, consistency, that's the magic there, right? For most of us. Otherwise, how do you do things? But Trisha, just taking it to the next level. So, you've been active for a very long time. You've been consistent, playing or doing some activity. How does that change your practice? So, of course, you're in sports medicine, but I do know of sports medicine doctors as well who are not necessarily active themselves, or orthopedicians, or whoever else, whichever other doctor. How does your practice change, and what do you bring because of being active yourself?
True. So I don't know if it's right to say this, but literally the first thing that a client or a patient or an athlete, when they either come in front of me or they get onto a phone call or they see my website or something like that, as much as we would like to deny it, your physique does play an important role. So I think a little bit of confidence probably trickles in the patient or the athlete that, okay, she probably, she's at least somewhere in that park. Okay, she may not be, if a gymnast comes to me, he knows, okay, I'm not a gymnast. Okay, but at least he or she knows that I'll be aware of certain things. Like, she's not somebody who is, not heard of physical activity at all type of a thing. So I think that's where the first thing comes in. And like I said, that because of the physical activity, it's because our field is so evolving, we have various types of exercises continuously coming around and everything. When a client speaks to you about something and you're like, okay, what is that? That kind of, again, gives a little negative connotation. So I try and keep up with everything that's recent, so that even if I have to suggest, or if they ask me something and if I have to counter it or something, I can do that. And the main thing, again, would be they know that if I'm advising physical activity, I'm doing it. It's like practice what you preach, So, then I have to literally tell them. Recently, I had a patient whom I referred to another physiotherapist for treatment. And I literally had to tell that lady that I send my mom also to her. My mom also goes to her. So, suddenly there was a complete change in the tone of that lady. So it's like, when you give them a personal example, things change. So when I tell somebody that, okay, I did this myself today morning, then the kind of confidence they're going to have in me and what I'm advising is going to change. And I think it was for that very reason that I took up yoga very recently. I took up learning yoga because, when people would come and tell me I did this asana and so, and that's when the pain started or something like that, I realized I needed to know a lot more of the science behind yoga. And that's when I decided to do a course in yoga. So again, I realized that once I finished the course and I came back, my language, I now knew the names of the asanas far more easily. So, and I could add on to it if somebody was talking to me. So again, like I said, the confidence the patient or the client gets, and they know that, okay, she practices, if I tell them that I mix up today morning, I did a yoga session. Yesterday, I did a gym session. So they realize that, yes, you're balancing everything, about everything. And sometimes I'd be a little maybe cheeky. If I know somebody is a hardcore yoga enthusiast, then I only talk of yoga. If I know somebody is like anti-yoga, then I stick to talking about resistance training and maybe just throw in a little bit. So I think all of that, I just try and balance it out.
Well, that's great. It's great that obviously you have a personal story and a personal perspective as well to bring to your patients. I expect that has a real profound impact on them. This is slightly going off script now, but I think it was just picking up on something that you were suggesting. How close do you think the science is to practice currently? So is science in agreement with the practice that a lot of these physicians are undertaking, or is there a slight difference there, do you think?
I think science is important because it gives you a little backing. And again, I use it while even advising, while in the clinical practice, I would use certain, I would tell the patient, if the patient's obviously fairly educated, that, this is what the current research is saying. And nowadays, because the patients are also reading a lot, they would probably do their homework and then come to you. That's the reason I think science would be important, because if I told them that do something and they would be like, I just received a WhatsApp forward yesterday which said something else. So, and that's the reason I think we need to be up with the science, and we need to tell them that, yes, this is what the study which was mentioned in that particular WhatsApp forward, that study mentioned this, but that was looking at people who are 30-year-olds and you are 50-year-old. So that's how this would be different for you. So I think science is important. Keeping up to date is important. The only hitch I feel that comes in with science is that by the time a study gets done, it gets published and we get to read it. That's probably about anywhere between 6 months to a year. Would you agree with me, Darren?
It can actually even be longer than that, I'd suggest. Yeah. It could be significantly longer in some circumstances.
Yeah, so I think that's the glitch which comes in with science. That and I think that's where the conferences which we attend make such a big difference. So I try to attend the conferences because then, something that I've heard on the weekend at a conference, and I can apply it right away. That guy, the researcher who's mentioned it in the conference, he's still probably writing a paper or he submitted the paper. It's at that level. But I think it'd be worthy. So that's where I think the conferences, academic, scientific conferences come into play. But I think science does have a role to play. I wouldn't, there are people who do things anecdotally and, they say this worked for somebody else, so I'm just going to use it. Yeah, it happens, but that's where, our research comes into play, that does it work for the majority of the population? Because, it could have worked for a once-off thing, but the whole science bit is when does it work for the majority? So that's where I would still use science. I still try to use science. Yeah.
Tvisha, I'm glad you took it in the direction that you did. But I think what Darren meant to ask was, like, knee arthritis, for example. and running. Most of our doctor colleagues, orthopedicians, have been saying, do not run, it causes knee arthritis. Then those gynaes are there who would say, don't run if you're pregnant, or if you're wanting to conceive, all that stuff. Then there'll be oncology doctors who'll be saying, don't exercise because you've either had cancer or you're a survivor or something. What's happening in our, in medical fraternity?
I think, like I said, how I considered my dad, who was a pediatric surgeon, to be the god. I assumed that he knows about exercise physiology, whereas what he read in exercise physiology was literally 4 lines in Guyton, which was like 25 years ago. Okay. So whether it's our orthopedic colleagues, whether it's the gynecologists, or it's who's the third guy, the oncologists, okay, they are great at what they do. But when it comes to exercise, I think exercise, it's a completely different field, right? Exercise physiology, exercise medicine. So I think I feel we should take education lectures for the orthopedic surgeons, the gynacs, and everybody else, telling them that this is how exercise plays a role in your patients as well. Because they don't know about exercise. The orthopedician as well, just because it's bones and joints, our common man thinks that the orthopedician knows everything. But the orthopedician knows how to fix a fracture, is what I feel. But I don't think he knows the physiology of muscles and bones and joints, which is what Darren knows the best, muscle physiology. What Darren publishes is what you and me read, and then we put it into practice. But I think we are the right guys to advise people on exercise rather than them, because I don't know on what basis they are putting those advice. Like when he says that it's causing osteoarthritis, I don't know on what basis they're saying that. So is my answer better now?
It's not, no. I mean, even the first one you answered, but this is brilliant. So I think the combination is great, right? I mean, both things. So we follow evidence-based medicine, and we are also taking on the whole medical fraternity as well. Yeah, of course.
No, I just feel like people are specialists in their own thing. Like the orthopedic surgeon fixes the fracture the best. But when it really comes to even a detailed evaluation of the musculoskeletal system, the detailed evaluation is probably, I mean, I'm not disregarding. There could be certain orthopedic surgeons who would do it brilliantly. But, their forte is really the fixing. Is really the fixing and all of those. That's their forte. So I do know a little bit of dermatology as a sports medicine physician, but that's not my forte. So it's just about what's your forte.
So how do you think we best communicate this to the medical community then? To really get them to come on board with this message that, sports medicine doctors, sports scientists, exercise physiologists can really have an impact with their patients. How do you think it's best to communicate that to them?
A lot of people, I think, are still not aware that there's somebody by a specialty called as sports and exercise physicians who do exist. So literally what I've been doing for the last 10 years is just going and speaking in as many forums as I can, telling people that, there's a specialty like this and, we exist and this is what we do. I'm glad that in the last, in 2019, I spoke in roughly 4 or 5 diabetic and obesity conferences. I was invited, to speak in, and these are national, really big conferences. One of the conference literally had 8,000 participants, one of the diabetic conferences. So I think when it's great that they invited, so there was also a diabetologist in that forum who was speaking on exercise. So that's fine. But luckily, they also invited me to speak in that forum. So I think, and everybody kind of, what I gathered is that they kind of valued the inputs that I brought into that forum, putting in certain new things, the kind of questions which came around during the conference to me. That people do have a lot of questions. They don't really understand exercise physiology well. The doctors, the diabetologists, the endocrinologists, and maybe just the physicians. They don't really know the whole essence of exercise physiology. which is valid. I mean, how much can you read? Nah? He can only read that much. He can read about diabetes and its complications. Like, he cannot be reading everything. So I think going and speaking to people, telling them that you're aware, and so following these conferences, people have not only been calling me for more conferences, but they would intermittently refer patients to me. There have in fact been some doctors, some bariatric surgeons themselves who've come to me for a consultation, saying that, we understand that you know about exercise. So, we also know because, we are either diabetologists or bariatric surgeons, but we figure that you know a little bit more. So that's how we're here to you, or you're coming to you for advice. So I think it's just spreading the word. We are very handful people still in sports medicine. Dr. Rajat, what would you say in the country?
Yeah, very few. And I think what happened is, courtesy Commonwealth Games, a lot of people are using this term, but are they truly, trained for it? So that's another thing. Right now, everyone kind of in front of it puts their name, this whole sports medicine. So taking on to the next question, Tvisha, most of our colleagues, whether they are sports medicine doctors or whichever other field, most of them are very inactive people. And we sit across the table and we are trying to preach, hey, lose weight and go exercise, go for the morning walk. And, we ourselves look like very spherical, very aerodynamic people, right? Smoking right after each patient and, things like that. How do we change that? Because without that, we're not getting anywhere. We can keep preaching. We too can talk to each other, all the three of us. But if we don't change ourselves from within the fraternity, we're not getting anywhere.
Yeah. I started on this mission a few years back of changing people, speaking to people, getting them to change. I don't know if I lost steam too early or I lost hope too early, but I figured it has to come from within. I heard another doctor speaking on your podcast when, he said that the pediatric surgeon, that, he began running and then people saw him and then they took inspiration and they, I think that inspiration has to come from within, that I need to do this. You're very correct. Like, we have so many doctors, physicians who are advising people, that you must do 1 hour of activity, and they themselves are probably not doing it. I think they have to realize that, yes, I also require it. There is, I've tried pushing people in the past, telling them the advantages. I think everybody knows the advantages of exercise. I think we are no longer worldwide at that stage where people don't know the benefits of exercise. I think the only thing we don't know is really getting the mind to, get to exercise. I think nobody doesn't know the benefits of exercise. Nobody doesn't know the benefits of healthy food. Everybody knows all of that. It just has to come. It's that one click which has to happen from inside that, yes, I'm going to get on to my journey. It's not the 1st of January tomorrow. It's the 23rd of March, but I am going to still start my journey tomorrow. I'm not going to wait for the 1st of January or for my birthday. So, I think, and very important that people should not just do it for a goal of losing weight. I think that's where a lot of people just falter so much. That's what I've seen, that, they feel that once they've achieved their goal, they can just stop, whether it was the weight loss, the wedding, weight loss for, something. I think, so that's the only real message that I now give to people is that the gym is not just meant for weight loss. If there's really something I try to drive into people is, you need to do exercise for healthy living, not just for weight loss, because everybody knows exercise is good for weight loss. But I kind of stopped pushing people to exercise unless they really come to me and ask for it, because I figured it's a dead end. They have to get that thing from within. What do you say?
Yeah, I think you're right.
Yeah.
We've touched on this on a number of podcasts now, that really it's about behavior change. So we can have, the most scientific evidence possible. You could have, as there are papers published in Nature, Science, New England Journal of Medicine, talking about all the very discrete things that are so important about exercise. But ultimately, if people don't have the motivation within, to actually go ahead and do the exercise themselves, it's not going to have any effect. So I think you're definitely right with that. So then moving on to the next question, what would be the common myths that you see, sort of that your patients are coming to you and they're sort of suggesting something which might not necessarily be true, that you kind of have to dispel for them?
As far as exercise is concerned, like I said, that the biggest thing is that the gym is just meant for weight loss, and somebody who is thin need not. For example, when I tell them I go to the gym, my BMI is well within normal limits. So when I tell them that, oh, I went to the gym or something, and they'll, oh, why do you need to gym? Okay, so I think that busting that myth that I don't go to the gym to lose weight, I just go to the gym to maintain fitness. So I think that's, like I already mentioned earlier, that's one thing I really try to drive into people. And I think myths like what Dr. Rajat mentioned about people coming and asking that, oh, somebody told me that if I run too much, it's going to cause osteoarthritis and things like that. So I would not really tell them that what you've heard is wrong, but I would really try and tell them that, if you strengthen your muscles and do things like that, you're going to postpone this whole thing. So I think taking it in a more positive way. So I currently work at the Reliance Foundation Hospital in Mumbai. And generally I'm associated with Reliance Foundation. So, whether it's our athletes, elite athletes, we deal with elite athletes. So even in elite athletes who have been training a lot, it's very common to see, patellofemoral pain and, things like that in the knee, which is, which the science is, science does say that it's wear and tear and is degenerative and things like that. So whether it's with those elite athletes or it's with my ultra runner, I really try and just push in that point that is the strengthening which is important. You could be predisposed to getting maybe osteoarthritis. Science is not very sure of that, but if you do these other three things right, then you're moving in the right direction. So I think it's about giving them the direction that which Dr. Rajat has also obviously, he harps on it every single video of his that I see, is that strengthening is important. So I think rather than telling them what not to do, I just would try and focus on what to do. That would be, so the myths coming from the gynacs when it comes to pregnancy or whatever, because I think there's ample evidence to say that exercise is really beneficial during pregnancy as well. So, I mean, all of those have enough evidence. So it's about just telling them, okay, what to do and what to do more scientifically. Even if you're pregnant, just don't go out and do something by yourself. Consult somebody. It could just be a once-off consult, but just so that the person can prime you on the do's and don'ts. So the same thing, whether it's elite athletes, the runners, just prime them on the do's and don'ts. So the don't would be, don't just exercise, don't just keep running. Do some strengthening as well, do some stretching as well. So for the pregnant lady also, there would be a particular do and don't like that. And if you have certain risk factors, obviously avoid certain types of exercises and things like that. So, and other myths, then coming to very specific myths, like, I mean, today morning I had a video consult in which somebody asked me about spot reduction. Can you please prescribe me an exercise for, losing the flab? So I think that's a very common thing I address, trying to tell them that you're exercising the muscle, you're not exercising the fat. So, I mean, routine knowledge for all three of us. But maybe those kind of myths, because people still have that thing of, it's making them realize that by exercise, you're exercising a muscle, you're not exercising the fat. So I think, that's a very common myth that has to be busted in various ways, Yeah, so I think those are the few common ones I can think of,
Brilliant, Tvisha. And, in closing, the last question or comment about, La Ultra. So a race like that, we are asking people or expecting people to run at 18,000 feet almost, between 11 to 18,000 feet, running silly numbers like 555, 55 to 555. What do you say about that? I mean, 10 years ago, no one could even dream about it. And now we have average people finishing a distance like 5:55.
Were
Someone
they
is not
average?
even
Sorry, I like to contest. They were not average people.
No, but just that baby steps, right? One baby step at a time, and what anyone is capable of achieving. What do you have to say about that?
I think, as you aptly call it, moving the mountains within. So there are obviously risks associated. I think you obviously are aware of that. That's the reason you take so much of precaution as well while you're organizing this. But it's about, like I mentioned in between, it's all in the mind. So it's all to do with the mind. I was really fortunate that I could be there for the 2019 one, and there were certain instances. I've quoted this at a couple of places when I felt that a particular runner on the medical grounds, when I saw that runner say at a 200 odd kilometer, I felt that he may not be able to sustain longer. But whole behold, he completed 5:55 maybe. So I think that's where the science probably, I don't know if the science went wrong, but my experience of sports medicine definitely was not sufficient at that point, because I actually thought I should, ask him to pull out for safety reasons, not just for, cardiovascular safety, but, safety from his knee point of view or something like that. But I think the person was just very determined in his head that come what may, I'm going to do it. And they did it. So it's really, I think it's a mental game, right? It's, of course, it's a physical stamina also. It's not just mental, because I must say I did see a few runners who were extremely strong mentally, but who probably, because of some physical drawback could not, did not complete. So I won't say it's a pure mental game. I think it's a brilliant combination of the two. I think and I think that's what life is about. So it's a combination of your physical and your mental strengths. So I think it's a great place for that. Yeah.
I mean, physical fitness by has to be there.
Yeah.
Only that gets you, your amazing fitness gets you to the starting line.
Sure.
But after that, it's all everything, right? It's more of an art rather than science, isn't it? After that.
Yeah, but that's where I'm saying that, there were some people, obviously I don't want to take the names, but who were, I think, mentally pretty strong and who were very determined to do it, but who unfortunately still could not complete because of either medical or physical issues. So, like I'm saying that and the vice versa. There were some people who had such physical things that I thought they would not complete, but they actually completed. So I think there were both scenarios, that mentally everything was perfect, but physical drawback. Physical things were not perfect, but mentally things were so great that it allowed you to push through. So I think it's all combinations, yeah.
Tvisha, just in closing, could you just take our audience through what were the conditions there? What all happened? Temperature, altitude, oxygen, heat. Could you just take them through to give a little feel? What is this race about?
Okay, sure. So I think the starting line, there was a little bit of drizzle, which was not something that the race directors had regularly been seeing. This was my first time at the race, so I was not aware of the environment. But of course, we were told to carry enough rain gear as well. But when it started with the drizzle continued. It went on to a near frank rain, and by night it was frank snow. It was frank snow, so bad that I was very much inside the car with the heater on, with a couple of gloves, a couple of socks, and just hoping that I don't have to step out for anything medical. Because I was quite frozen. It was, it pretty much snowed nearly all through the night. So it was rain, snow, night, altitude. I think it was a perfect recipe for a lethal. It was. Like I said, it was my first time, so I wasn't sure if the race would continue. Would it be called off, or I wasn't honestly mentally prepared for this. All I knew is that we had to expect the unexpected at the La Ultra, and I think that's the experience I got. And and this was not just the first night. The whole atmosphere, the things did get better in the next few days, but basically snow persisted. Then because it had snowed, the snow persisted over the next few days, and I think people were not very accustomed. Everything from their shoes and everything was not totally accustomed for snow. I think it was meant to be all weather, but I think snow is different than all weather still. So I think it was a dangerous. It was skiing. It was skiing weather. Let's say this. It was a weather to ski rather than to run. I think I've done skiing. I used to go on skiing expeditions. So it was a good weather for skiing.
Thanks, Tvisha. Thank you.
Okay, I think we'll bring the episode to a close there. So thank you very much for joining us, Tvisha.
Thank you for having me, Rajat and Darren.
It's been an absolute pleasure to have you on. And we'll speak to you soon.
Sure. Thank you. Nice meeting you.
Thank you, Tvisha.
Thank you. Bye-bye.